You never realize how crucial your elbow is until you've injured it. A lot of us have been there. You're playing tennis, walking the dog, or in a game of tug of war, and you feel it, a pain in your elbow. Now what? Do you ice it, ignore it, call the doctor immediately? Today we'll find out all about elbow pain and injuries with Dr. Matthew Gordon, orthopedic surgeon at Montefiore St. Luke's, Cornwall, who will fill us in on elbow pain and injuries, what the symptoms are, and when to get treated, among other things. Welcome to Doc Talk, presented by Montefiore St. Luke's, Cornwall. I'm Maggie McKay. It's wonderful to have you here today, Dr. Gordon. We're very excited to learn more about elbow pain, which so many people have experienced once or twice in their life, at least if they're at a certain point in their life. What are the most common types of elbow injuries and pain?
So probably the most common is tennis elbow, the dreaded tennis elbow. People get it fairly frequently. In fact, I think 90-something% of people between the age of 35 and 65 are going to get some variant of it at some point in their life. It's characterized by pain on the outer part of the elbow. Typically, it will radiate down the forearm, and you'll have trouble lifting or gripping. The reality is that while it's common in tennis players, it's actually much more common in people who don't play tennis. So you don't need to have a tennis game in your repertoire to get this.
So what are some of the causes of elbow pain besides playing tennis? Let me redo that. I'm sorry. What are some of the other causes of elbow pain?
So most causes of elbow pain are due to overuse. That's probably the number one cause of elbow pain. It can be anything from tendonitis. However, other causes are generally due to trauma. You see a lot of injuries. People fall on their elbow, sporting injuries, whether it be dislocations, fractures, that kind of thing.
Speaking of fractures, how do you know if you have one?
The only definitive way is to get an X-ray. There are some fractures that are so subtle they actually don't show up in an X-ray. However, if you see an orthopedic surgeon, they'll be able to evaluate you, and usually they'll be able to figure out what's going on with that.
And what are the symptoms? How do you know what to do as far as ice, heat, call the doctor?
So in general, any kind of acute injury, meaning an immediate injury where you're getting swelling, you're getting pain, I would start off with ice. Heat is generally better for any sort of muscle strain type thing to help loosen it up. But any immediate injury, ice is sort of the number one. As far as when to call a doctor, certainly if you've had an injury and you're getting significant pain and swelling, definitely a good idea to get checked out. But as far as sort of the other more vague onset kind of things, those you can try to treat at home with ice, anti-inflammatories such as ibuprofen or naproxen, if it's appropriate for you to take that.
And if it's not an injury, if it's just nagging pain, what are the consequences of not taking care of it or seeing a doctor for years? Because some people actually just wait it out and say, oh, I can live with it.
Well, there are certain things that will, frankly, self-resolve. But the problem is that, well, we would hope that everything will self-resolve. The reality is not everything will. And there are certain things that can cause more permanent damage to tendons or bones. It's always a good idea if you've been putting something off, don't put it off. Get it checked out, get evaluated so you know what you're dealing with. And if it's something that will resolve on its own, well, you'll be the wiser for it.
And how often is surgery the answer to elbow pain? Or in what instances?
Less than 1% of the time for most causes of elbow pain. It's fairly uncommon, actually. Most of the time, unless it's an injury, let's say a tendon rupture, like a bicep tendon rupture or a tricep tendon rupture, those will require surgery. Many fractures in the elbow don't require surgery. There are some, obviously, that do, but that's something that, frankly, on the grand scheme of elbow injury is uncommon.
Now, I probably should know the answer to this, but I don't, and I'm dying to know. So there are knee replacements, hip replacements. Are there elbow replacements? Does your elbow ever just wear out?
So there are elbow replacements. You probably have not really heard of too many people getting them because they're fairly uncommon. There's a number of reasons for this. Number one, the elbow doesn't get arthritis as frequently as hips and knees because it's not a weight-bearing joint. So just in terms of the overall number of elbows that are going to get arthritis and therefore possibly be a candidate for an elbow replacement, those are very few. The second part of it is that, frankly, they're just not as good as knee or hip replacements. They just don't last as long. They're not as durable. They don't allow you to do as many things. They're really more of a salvage operation for people who have intractable pain. sometimes if it has bad enough fracture, and usually in people who are, we call low demand people who are maybe a little bit older, whose just functional requirements of their arm are not as great.
And once someone does come to your office, where do you go from there as far as treatments?
And initially, obviously, it's evaluate the source of the pain. How long has it been going on for? What makes it worse? What makes it better? Has there been any sort of treatment, whether it be anything as simple as icing or Advil? And then looking at x-rays. Is there any kind of bony deficiency or bony problem that would need to be evaluated? And then depending on the cause, it could be anything from physical therapy to treat it, additional anti-inflammatories or stronger anti-inflammatories, additional icing, and then cortisone injections are also generally helpful for elbow issues. And then finally, obviously, surgery can be an option depending upon the condition.
And I'm sure it varies from case to case, but is there a norm for the amount of time it takes to heal from an elbow injury or elbow pain?
It really does vary case to case. It depends on the cause of it. It can be anything from a few weeks to months to, frankly, some things that even take a few years to actually fully get addressed.
Wow. So how do we prevent elbow injuries or even elbow pain? Is there any way?
I don't think you can prevent it completely, but obviously be smart. If you're doing something and it's hurting a lot, stop doing it. Take a break. There are certain things, let's say you're exercising and your muscles get a little bit sore. Well, that's probably a no pain, no gain situation. But if you're doing something and it's really hurting the elbow and every time you do it, starting it more, that's not a no pain, no gain situation. That's the time to stop, take a breath, get it evaluated, see if there's anything that you can do to get it better, and then go on. But it's basically, you got to let your brain be your strongest muscle. You got to be smart about what you're doing.
Right. Dr. Gordon, is there anything else you'd like to share with our listeners that they need to know about elbow injuries?
Generally, most of them are treatable and most of them can be resolved. Don't be afraid to get them evaluated. Most things, as I said, do not need surgery. I think people come in with a preconception that they're going to see an orthopedic surgeon and they're going to automatically recommend surgery. But the reality is it's very, very uncommon to need surgery for an elbow condition.
Well, that's very encouraging, especially for people who have had elbow injuries. I mean, it's as simple as once I was walking my dog and he charged after another dog and he's big and heavy. And honestly, I felt like my elbow had been disconnected from my arm, but it did heal itself in the end. But it took about a year.
Right. Yeah. Most of these things, they're not the kind of thing that's going to be persistent. Most of them are going to heal, but it sometimes is being a matter of being patient with it.
Right. Thank you so much, Dr. Gordon, for sharing your expertise and educating us on elbow injuries and elbow pain in general.
Thank you so much for having me.
And thank you for listening to Doc Talk, presented by Montefiore St. Luke's, Cornwall. For more information about our orthopedic services, please visit www.montefioreslc.org. That's montefioreslc.org. Please remember to subscribe, rate, and review this podcast and all the other Montefiore St. Luke's, Cornwall podcasts. If you found this podcast helpful, please share it on your social channels and check out all the other Doc Talk episodes. Until next time, I'm Maggie McKay. Be well.